Hi, my name is Dr. Stephen Stokes. I own Advanced Pain Solutions in Fort Myers, Florida. I want to talk about pain. I want to talk about traditional models of pain that are based on structure, and I want to talk about the new model of pain, which is neurological. The neurological model of pain is the only model that works if you're suffering from chronic conditions. The structural model, the idea that there's something broken or damaged in your body that needs to heal for you to get better, it doesn't work and it doesn't make sense because we know that tissues heal in, certainly 8 to 12 weeks. So if you've had a bad knee or a bad shoulder or a bad back for a longer period of time than that, it can't be structural damage, unless you've got a knife in your back. Those tissues should have healed properly by then, but you can still have pain. The neurological model is the only model that makes sense, and it's the model that's going to give you or your doctor or your therapist or whoever you're going to, it's going to give them the pathway and the roadmap to get you better. You have to adapt the neurological model of pain to understand yourself, what's going on, and to see how you can get better. So the easiest way to explain it is as follows. If you were to step on a nail, how would you know that you stepped on a nail? Well, it's obvious. Your nervous system. Your body has a complex group of nerves. There's over 400, and those nerves monitor everything that's going on at all times in your body. This nervous system is really your body's alarm system. It tells your brain what's going on. Those nerves are buzzing along with a little bit of electricity in them, minding their own business, doing their job every day, just buzzing along. When something bad happens, like stepping on a nail, those nerves increase the firing. They increase the electricity in the nerve and they fire more. If that firing goes beyond a certain threshold, your alarm system goes off. And that threshold is the same for every human being. The same. People who say they have a high threshold to pain, there's a different reason for that, and it isn't because the nerve is different. We're all the same, we're built the same structures, the same firing potential. So you step on the nail, it increases its firing. If that firing goes beyond the threshold, the alarm goes off and you have pain. Now, what happens when you pull the nail out of your foot? Does the pain go away right away? No. It usually lasts a few days, maybe even a week, and slowly, as that nerve calms down and the electrical firing pattern of that nerve decreases, the pain usually decreases along with it. And that's normal. And by the way, that's happening right now in your body every day, all the time. You've probably hurt yourself, 100 times yesterday or the day before, and your body's gone through this process, and you haven't continued to have pain. You may have bumped your elbow this morning while you're brushing your teeth. Oh, that hurt a little bit. Pain goes away, right? Or you bruise your leg. You see the bruise. You know it hurts. But then the bruise fades, and it resolves certainly within a few days. This is normal. But here's the problem. 20 to 25% of the population, when they hurt themselves, that nerve never resets back down to its normal firing pattern. Never reduces itself back down to a normal level. 20 to 25% of the population. This is crazy. And nobody tells you this. And what happens is that nerve, it goes down a little bit, but it never goes down enough. So even though the patient may not have pain, what happens is that they have no wiggle room. Wiggle room, that's what I'm saying. They have a very small potential for activity because the nerve is constantly firing at too high of a rate. Or an easy way to think of this is it's sensitive. Or an even easier way to think of this is like an alarm system in your home. If you have an alarm system in your house and it's set properly, the alarm system goes off when somebody breaks a window or when somebody opens a door. If that alarm system is set too sensitive, then that's going to go off when, for example, a leaf just happens to blow through the living room. We don't want that. Same thing with your body. If your alarm system or your nervous system is sensitive, if it didn't reset, if you're in the 20-25% of the population that doesn't reset, you've got a big problem. Because the tissue itself doesn't have to be damaged. It doesn't have to be that you need to repair something. It's just simply that the nerve itself has never reset. And it's a big problem for most people who are experiencing pain. So, what do we do about this? Well, we have to do specialized treatments to restore the proper firing of that nerve. And this is critical. If you are focused on a structural model, if you believe that the reason you're having back pain is because you have arthritis in your back, which, a huge amount of the population has arthritis in their back and has no back pain, by the way. In fact, if you look at the correlation between arthritis and back pain, most people, the most highest incidence of back pain is between 50 and 60 years of age. Okay, it peaks between 50, 60 years of age, and then it decreases if you chart it. But we know that arthritis is this way, meaning that arthritis always increases, degeneration increases with age. So if that's the case, we should see more back pain in people in their 80s than we do in the 60s. It's not the case. So the correlation is not there. The science is not there to support this. We need a different model than the structural model. We need a neurological model. If you adapt a neurological model and you choose treatments that help the nerves heal, help the alarm system reset, you will be successful. It is the only answer if you're suffering with chronic pain, chronic back pain, neck pain, shoulder pain, fibromyalgia. All these conditions are being mismanaged and mistreated by the structural approach. You need a neurological approach. If this stuff speaks to you, if you're interested in learning more, call my office and we can talk and I can explain more of it to you. It's a fascinating topic and it helps a lot of people. Many times I'll have patients who've had pain for 10, 15 years, and in the matter of 30 days with the right approach, they're feeling better, their activity level goes up, they're golfing, they're doing things they never thought they were going to ever be able to do again. And here's the crazy thing. We could take an x-ray of that patient, they still have arthritis. The arthritis hasn't gone away. There hasn't been a miraculous improvement in their arthritis in their spine, but they're golfing, they're swimming, they're dancing, they don't have any pain.